Now, while responding to a building collapse linked to possible terrorism, you hear of victims experiencing breathing difficulties and an almond like smell in the area. What substance would you suspect? Would it be A, carbon monoxide, B, methane gas, C, nerve agents, or D, cyanide? So, if it was just shortness of breath, there's several of these that would cause shortness of breath, but one has an almond like smell. Now, before I get to that, there's some buzzwords that I want you to know about a few of these. Now, with A, carbon monoxide poisoning, you'll typically see test questions that talk either about a car that was left on or a generator that was found inside the house, or everyone has a headache. They sometimes even use cherry red skin, which is a very late sign, but nausea, vomiting, things of that sort. With nerve agent exposure, this is your organophosphates. We need to think sludgeum or dumbbells. Remember, that's salivation, lacrimation, urination, defecation. Our patient's going to have emesis. They're going to have bradycardia. They're going to have wheezing. They're going to have pinpoint pupils, also known as meiosis. But in this question, with the almond smell, we're talking about cyanide. Now, with cyanide, your patient's still breathing and there's still oxygen inside of their bloodstream. But because of the cyanide poisoning, their tissues are unable to use the oxygen. So our patients become very hypoxic, and this can be deadly. They do need an antidote, which we often call the cyano kit. And just so you're aware, most patients that suffer from some sort of cyanide poisoning is from a structure fire or from a car fire. When you have burning of synthetic materials, it does emit cyanide gas or smoke, and this can become very dangerous for our patients. So we always need to keep an eye out for our patients that appear very unstable, seizures, unresponsive, altered, short of breath, hypotensive. They have a potential for cyanide poisoning. Hope this helps. Again, almond like smell in the area, D, cyanide.